you think of health and wellness, what comes to mind? Maybe it's what you ate this morning, or your workout yesterday, or that doctor's appointment last month, or all those times you've thought about starting to meditate. But what if I told you that one of the biggest determinants of your health is your zip code? Take a look at this map of the DC metro area from researchers at VCU. You can see the differences in life expectancy from 94 years in Georgetown to 78 years here in Alexandria to just 67 years in Trinidad in Northeast DC. That's an almost 30-year difference within just 5 miles of each other. Place matters. Our health is determined by the ripple effects of sidewalks and parks, access to healthy food and adequate housing, clean air, and safe neighborhoods. Research shows 80% of our health is determined outside the 4 walls of hospitals and doctors' offices. Our health is driven by the places where we live, work, learn, and play more than anything else. And yet, the vast majority of our time, our money, and our attention is devoted to addressing health and wellness at an individual level. We turn to policymakers debating health, and what they're really debating is medical insurance. We turn to the media covering health, and what they're really covering is clickbait recipes and workouts. All of this attention at an individual level sends the message that you alone control your health. So if you're not healthy, blame yourself. And if someone else isn't healthy, well, shame on them. No wonder then that when we're asked to think of health and wellness, we think of our personal behaviors. No wonder then that of the $3.8 trillion spent on healthcare in this nation, just 3% goes to support population-level public health efforts. Like jamming a square peg into a round hole, like my daughters are trying quite unsuccessfully to do in this picture. There is a fundamental mismatch between the individual level at which we think about and try to improve health and the population level at which health is actually determined. And this mismatch, it's hurting us, costing us, and even killing us. Life expectancy in the US has gone down in 4 of the last 6 years. Healthcare costs have risen 6-fold in the past 50 years. We face stark health disparities by race and income and zip code, and we were woefully unprepared for COVID-19. COVID-19 pressure tested many of our systems, from contact tracing and surveillance to public health communication and policy, and many of these systems failed because we haven't focused on or invested in strengthening systems. And it's not unique to COVID. Take almost any health issue, and we expect individuals to make healthy choices without creating healthy systems. Let's look at obesity. We weight shame and we beat ourselves up for slipping up on the most recent fad diet. At the same time, we fight tooth and nail against policies that would limit portion sizes, or tax sodas, or change zoning laws in ways that would make healthy food and safe green spaces more accessible to low-income and minority communities. So that's a lot of gloom and doom for a talk that's supposedly about health and wellness. What can we do about this mismatch, right? Where are our round pegs? The good news, and yes, there is good news, is there are plenty of examples of what can work, of how all of us can better match our solutions to the population level at which health problems are produced. But before we get into that, let's talk a little bit about what population level thinking and solutions even looks like. One of the first things I learned as an engineering major in college was to always take a few steps back and examine the system as a whole. But it's not until I got into public health and heard the upstream-downstream parable that I really understood what this looks like. The story goes like this. A couple is fishing on a riverbank, and all afternoon, they see people struggling in the current and rescue them one by one. Finally, they go upstream, where they discover an unprotected overlook where people have been falling in. They realize that if they could put up a protective barrier and post some warning signs, they could prevent everyone from falling in, instead of rescuing folks one at a time after they're already drowning. Protective barriers and warning signs are just two examples of the kinds of systems changes we focus on in the public health field. We spend our days thinking about things like designing neighborhoods more conducive to exercise, reducing air pollution to prevent asthma attacks, pursuing policy changes to ban false marketing by cigarette companies, and redesigning cars and roads to prevent injury. So, what do all of these have in common? They improve the health of entire populations, not a single person. They change systems, not individuals. And they prevent illness before it occurs, not treat it after the fact. So now you know what population-level solutions look like. But I suspect you're thinking, I don't design neighborhoods or roads. What am I supposed to do about all this? Here's what you can do. Put down the square peg. Pick up the round one. Individual level approaches to health are not the answer, but each of us individually does have the power to shift from individual level thinking and solutions to population level thinking and solutions. So what are those round pegs that you can start picking up and using today? Let's get into it. Round peg solution 1, broaden your perspective. Let's stop blaming and shaming and consider how to prevent poor health outcomes at their root. The next time you find yourself judging yourself or someone else for what appears to be a personal health choice, ask yourself, what else might influence a person's choices? Consider systems-level factors, especially their physical and social environment, the influence of policies, and the role of powerful institutions. Let's stick with our obesity example from earlier. Consider a neighborhood where fast food and junk food are around every corner. Consider a country where billions in farm subsidies flow to support production of corn and soybeans used in processed foods. Consider a food and beverage industry that does everything in its power to weaken dietary guidelines and manipulate research. Also ask yourself, what factors might lead someone to poor health even if they did make healthy choices? Consider the impact of decades of racist policies, from housing to criminal justice to education, and generations of poverty due to unjust economic systems designed to keep the poor poor and make the rich richer. The ultimate point is that systems shape choices. And by designing systems differently, we can make the healthy choice the easy choice for all people. Round peg solution 2. Change the systems you control to improve health for the populations in your life. You might think there are no systems you control or populations you influence, but think again. Does this look familiar? Instead of expecting those you live with to magically make healthier choices, you can redesign this system to make the healthy choice the easy one for everyone in your household. Move the junk food and the sodas to the back, to the drawer, to wherever will make them harder to grab on a whim. On the flip side, move fruits, vegetables, and other healthy items out of drawers, where they're out of sight and out of mind, into places where they're easily visible, and change how you prep and store them so they're quick to grab. Of course, redesigning this system in this way requires access to healthy foods, which not everyone has. But I share this as one example of a systems level, population level change that might be entirely within your control. And I hope it's just the start to thinking about broader systems and populations, because your home refrigerator isn't the only system you control, and your household isn't the only population you can influence. For example, think about integrating physical activity into your meetings and other gatherings to get everyone present moving. Or consider getting involved in a community garden to improve health and environment for your entire neighborhood. Round peg solution 3, raise your voice. Organize and advocate to change the systems that are out of your control. Make your voice heard and elevate the voices of those who aren't usually heard. The Los Angeles Unified School District increased its local purchases of fruits and vegetables from 9% to 70% of its $20 million annual produce budget. They did this through the Good Food Purchasing Program, a policy the local Food Policy Council developed and advocated for that asks institutions to sign a pledge to buy food that's local, sustainable, nutritious, supports workers, and protects animal welfare. The policy's success has led to it being replicated by school districts, local governments, and other institutions in 16 cities across the country that collectively spend $1 billion on food each year. This is the power that communities coming together and raising their voice can have. To advance systems changes like this, you can get involved in neighborhood organizations, city councils, and school boards. You can vote and campaign and donate to support candidates and organizations that pursue these kinds of systems changes, whether that be around food access, affordable housing, or any number of other upstream factors that have a huge impact on our health and well-being. Look, at the end of the day, continuing our fruitless efforts to force our individualistic square peg solutions, along with trillions of dollars, into a round hole is leaving us with worse health and higher healthcare costs. Listen, I know we're an individualistic society here in America. We want to pull ourselves up by our bootstraps and manifest our way to health. But that approach to health is all wrong. There are too many broader forces at play. Our health is driven by the policies, environments, and other systems in the places where we live, work, learn, and play. So take a look around every room and every building and every neighborhood and community you're a part of, and try to spot these broader forces. Put down the square peg, pick up the round one. Put down single-person solutions and pursue population-level solutions instead. Put down your efforts to change individuals and change systems instead. Put down after-the-fact treatments and prevent illness instead. You have the power to make this shift. Broaden your perspective, change the systems you control, and raise your voice. Armed with these 3 round pegs, I hope we can all go out into our homes, our workplaces, our schools, our communities, and meet our population-level health problems with population-level, systems-level, preventive solutions that leave everyone smiling and cheering. Thank you.